Welcome everyone to our Wednesday afternoon acupuncture meeting for the residents at our clinic. And today we're going to talk a little bit about acupuncture and how to make it more effective for your clinical experience, okay? Now, a lot of people come here, a lot of patients have joint problems. Their wrists hurt, their hip hurts at the greater trochanter, every joint, the shoulder joint and so forth. My method of acupuncture encompasses a lot of different systems. That's why I don't call it the balance method, I call it DNA acupuncture, because it really isn't Dr. Richard Tan's method. It's my method, and a lot of my method is anatomically based. So what that means is if the patient has pain in a particular joint, like the greater trochanter. Now, it's true that that's the tensor fasciata muscle area of the body. And the vessel, which is responsible mostly for delivering blood, oxygen, and nutrient into that area of the leg, is the Shaoyang, foot Shaoyang vessel. So we could say that the greater trochanter area of the body is a foot Shaoyang area, okay? But because the problem is in the joint, as an acupuncturist, it will behoove you to needle other joints in the body which are associated with that hip joint and are also associated with foot Shaoyang. So you can go, first thing you can do is you can go to, the styloid process is over here, you can go to this ulnar process on the wrist, which is in the area of hand Shaoyang, and you can put 3, 4, 5 needles right into that bony knuckle area at the head or at the top of the ulnar styloid process. Okay? Does everyone understand this area right here? You don't have to needle the Sanjiao channel. Just stick your needles all in that little joint area, just right onto the bone there. The next thing you can do is go to the opposite leg on the medial malleolus. And on the top of the medial malleolus, you can put a lot of needles, 3 or 4 or 5 needles, right into the medial malleolus, right down to the bone. That's, if you had to look at it from a vessel point of view, that's foot Jueyin, and we know that foot Jueyin treats foot Shaoyang. We know that. But we're not really putting needles in the liver acupuncture points. We're putting them in the area of the Jueyin vessel, but we're putting it on a joint, a big knuckly joint, and I can guarantee you that big knuckly joint is associated with the hip joint. So you can needle that. And then you can go to the same side hand and needle the ulnar styloid again on the same side as the pain in the hip. Okay? If you do that, you run a good 95 to 98% chance that you will eliminate the complete pain, even if it's bursitis, in the person's hip joint. And so you did not needle any classical acupuncture points. You even needled areas which are not typically associated with a particular vessel. You're sort of off the vessel a little bit. That's fine too. Because the body is so holographically organized neurologically that every area of the body is related neurologically to every other area of the body. And the greatest similarities, the greatest relationships are the joints are all related to one another. So one joint can treat all the other joints. And the areas between the joints, like the area between the knee joint and the ankle joint, that in-between area can treat all the in-between areas all over the body between major joints. And yes, we have these relationships where the outer can treat the inner, yin can treat yang can treat yin, and yang can treat yang from the lower part of the body to the upper part of the body. You can do that. But I'm just telling you, you can even ignore that. And you can simply needle, you can decorate an area between 2 joints. And it will take away muscle pain somewhere else in the body between 2 major joints. It will do it. And you can even needle the same side if you want to. So there is a lot of flexibility in what I call DNA acupuncture. And it will free you up from this sort of point neurosis that a lot of acupuncturists have, you know, this is the point and I have to, that is not true. You can all you have to do is be in the right area, but for sure, if the pain is in the joint, then you have to be needling some other joint. If the pain is in the muscle, you have to be needling some other muscle. If the pain is in the skin, if it's like a herpes or shingle pain, you have to needle somewhere into the skin. That's an important rule. The pain is on the bone, then needle down into the bone. You can use these vessel relationships and they will serve you well, but you don't have to be married to them. In this way, if you become good at this, you can literally treat everything in the body. You can treat everything in the body simply by treating any finger. You can choose any finger, because every finger has a joint, 2 joints, 3 joints, and there's the area between the joints. So if a person has a pain in the bicep between the shoulder joint and the elbow, you can simply needle between this big knuckle here on any finger. Let's take the middle finger or the second finger. You can needle here, and here's another joint, the middle knuckle. You can needle right in here all the way around. You can needle on the yang side or you can needle on the yin side. It will take this pain away. Do it and see what I'm saying. It's true. Thank you very much.